I always wanted to do something from the STEM basis, so the science, technology, engineering, and mathematics, and genetics always seemed to be very appealing, and it's something I felt like I could really benefit the community that I was in. And then as I went down that path, genetics kind of folded in a little bit into medicine in my path, and as I spent more time with medicine and saw that I could directly impact individuals within the community, it really drew me toward in that direction. And so that really solidified when I actually got to directly impact patients, work with patients, work with other medical students and physicians. It was too enticing, too much fun, too many opportunities to say no. And so that's kind of what drove me in that direction to pursue medicine. My medical school was University of Nebraska Medical Center in Omaha. I was born and raised a very, very small town in Nebraska. And so I was at University of Nebraska-Lincoln, and then it came natural to kind of transition up into Omaha at University of Nebraska Medical Center. I spent 4 years there and did 1 year of internal medicine at University of Nebraska Medical Center as well. And then as I was interviewing nationwide, I had an opportunity to visit down in Phoenix. At the time, we did not have a residency actually at Valleywise. There was a residency at St. Joseph's. And I just loved the Phoenix community. I loved everyone down here that I met seemed great. It seemed like, in Nebraska, there's kind of everyone's very nice to each other. Everyone's very, it just seems like a community. And as I went through the Northeast, as I went through the rest of the nation, it was extremely nice, but it didn't feel like community until I came into Phoenix. And all of a sudden, everyone seemed to have that really good attitude. They're laid back, friendly, great to be around. And so I really felt like this was a community that I could fit into, that this would be a great place. And then obviously St. Joseph's and Valleywise, all those different areas, all those different medical systems are exceptional for education. And so I was fortunate enough to match here down in Phoenix for residency and spent 4 years down here for diagnostic radiology. And then I went and did a 1 year neuroradiology fellowship at Barrows after my residency training. And then I went and worked in North Scottsdale, did a visiting fellowship in musculoskeletal imaging as well. So that's the long path that I've taken to finally complete my graduate medical education and start working. There were multiple things that drew me to Valleywise. So the patient population, we get patients from all walks of life. We get patients with all means and abilities to kind of pay. And so we're definitely there for the entire community. Some of the other areas in town, rather you get there, you sit in the seat, you work really hard and you leave, but you just don't have at the end of the day that feeling, that sense that you're really contributing a lot to the entire community. Valleywise was a no-brainer there. I mean, there are huge opportunities to contribute to the community and make Phoenix a better place. In addition to that, I kind of mentioned that we didn't have a residency, or at least a residency did not exist at Valleywise when I was going into radiology, but one actually did start while I was a resident over at St. Joe's. And it was very, very new, very early in the days of the Valleywise radiology residency. And I thought, wow, this is an amazing opportunity to kind of craft this residency, to work with those residents, build them up and make this an absolutely amazing program. It's just been a fantastic kind of journey with amazing residents, some amazing staff that I've been able to work with at Valleywise. But the opportunity is there to help with community and then to build and to create the amazing residency with the team that's there. It was an opportunity I just couldn't pass. It was lots of things to draw me over to Valleywise. The Creighton Alliance has been amazing for us. The opportunities there are pretty spectacular. So we had a residency at Valleywise, and it had become very, very good. I mean, it's just amazing residency. St. Joseph's had a residency for a long time. And we knew a lot of the different attendings, the different leadership at each of the different programs, because we had worked with each other for so long. And we said, you know what, this is a perfect opportunity for us to bring everyone together, to have the largest number of experts in radiology here in Phoenix and Arizona to teach our residents, because we'd be combining all of those different experts in radiology. Not only that, we would have an opportunity to work with a public hospital, a private hospital, VA, Phoenix Show. So there are multiple different healthcare environments that the residents could learn from, where there were no real areas where we didn't have a subspecialty of medicine covered in Phoenix. And so it was just, it came natural to us to bring everything together. There are, every healthcare systems has slightly different cultures, but as we've gone through the process, it's been an amazing kind of journey that we've taken down this path, and working with all the different residents in the different levels have been amazing. Truly have. I mean, the residents are some of the best that I've been around. They're hardworking. They're energetic. They're cliche, but they're the reason why I get up in the morning and go. The survey community is amazing and work, but the residents really keep the interaction, the fun, the energy for education, for research, and for helping with the healthcare of the community, and it brings it all together. So it's just kind of a perfect combination in my mind. I've had a couple of mentors through the years in radiology, and one that was my program director at the St. Joseph's residency. His name is Dr. Sanford Ornstein. He is now semi-retired. He is absolutely spectacular human being, just an amazing person. And he's one of those people that make you feel like you're safe no matter what you say. You could say the most incorrect answer and you still felt like you're in a safe place, a warm place, where he would say, well, if you said the opposite, it would have been perfect. You still did a great job. So he really fostered an environment of learning, of kind of a team, almost like a family atmosphere, and made it a lot of fun to be there. And we worked hard. We worked long hours. We learned so much, and he really was the anchor that made, or the glue, I should say, that brought everything together for that residency. And he is a spectacular person. And I would say the other is Dr. Randy Richardson. He came into the program when I was, I believe, a second year resident, and we all just said, this guy's spectacular. He's amazing. Brilliant. He's great with people. He's a natural leader. He can't help himself. He accidentally leads everything. It's one of those people where they don't really necessarily put themselves out there, but when they lead, they just do an amazing job. And obviously that has worked well for him, and that now he is the Phoenix Creighton Dean. So those are probably the two that had the most impact on me as I went through my radiology training, and definitely two pretty amazing people. Is there a typical day? And that's part of the reason why I truly love working at Valleywise. There's always something interesting. There's something new. There's something on the horizon that we're doing. So I have the opportunity, and it's a true pleasure to be able to do it, to work with the residents, to work with the medical students, both Creighton and U of A typically, but we get medical students from all over the nation that want to rotate with us. So I get to teach all these different levels and have that opportunity. And in addition to that, obviously, one of the bigger components of what we love to do is providing the clinical care for our patients here within the community. And then on top of that, we get to work with strategic alignments. We get to look at the new healthcare system with Care Reimagined. We're spending large amounts of time, which is great, for making sure that we're planning. We're doing a very, very good job of putting together an amazing future healthcare system as we progress through Care Reimagined into the new hospital and some of the new healthcare systems. So working with residents with education, I get to meet and do some research. I get to do some I get to partake in kind of some administrative tasks. Get to work with strategic. You can imagine, like, every day is a brand new experience. I tell all my residents the most amazing thing is I'll show up at 6:30 in the morning. and I'll turn around and it'll be 3 or 4 o'clock, and I have no idea where the day went. It's just amazing how everything is just so fun. It's just so interesting. It's just so engaging. There's challenges, but they're fun. So the typical day is that there is no typical day, and that there's just so many different types of tasks that we get to do. It's amazing, and like I said, it really is a pleasure to work throughout the day. The day flies by so fast, and you just wonder, how could I have just been here for 10, 11 hours? I feel like it's been 1 hour. So yeah, and I could get a little more granular on that, but suffice it to say, I try to carve out 3 to 4 hours a day for clinical work, and then it explodes from there to the administrative, the planning, the scheduling, the research meetings, the academics, the lectures, all the good stuff. But the Valleywise Health system has been making sure we are intimately involved. Everyone is intimately involved in the process, which has been spectacular. So we all get a voice. We all get to kind of point out what we think would be best case. And then obviously they'll take that to the teams and figure out what the best plan would be from there. And so we've been working on the large new multi-specialty center in Peoria, but it has all of our medical imaging equipment in it. It has our offices, it has all the patient care space and areas, and that's pretty much comprehensive imaging. We have MRI, there's CT there, there's mammography, ultrasound, X-ray, the whole gamut is there. And then we're obviously planning on the new hospital, which it's a couple of years down the line, but it's getting closer. It's coming so much faster than you anticipate. And there again, we're going to have obviously the comprehensive imaging capabilities, MRI, CT, ultrasound, nuclear medicine, interventional radiology. So all of these need to have specific time carved out to plan for every single one of the modalities, every single one of the rooms that we're looking at, the layout, the flow for our patients, to make sure that it's best for everyone, whether or not you're coming in as an outpatient or whether it's an inpatient in one of the towers. So there's a lot of operational work that goes on, and they've had us intimately involved from day one on all of this. And this has been years in the planning so far, and we have years to go. So it's been a pretty amazing process, and it's a lot more to come as well. I've heard other systems will have consultants kind of drive the path. But Valleywise has engaged all of the physicians, all of the nursing staff, the techs, the environmental staff. Everyone is fully engaged all the way through the process. So it's made it, I think, so much better for the future product, because everyone will get to be able to say, hey, this is what's going to be best for the patient. We kind of collate everything and come up with what's best. The most, I think, interesting interactions have been with patients that have medical imaging and are uncertain of what those results actually mean. And so we do love it when we can actually kind of answer some of those questions for those patients that are uncertain. So we had one patient, this would have been a few years back, that had a soft tissue hemangioma, which is a benign kind of cluster of vessels underneath the skin. And they thought that it was something that they were not going to be able to survive with. So I was able to sit down with them, show them the imaging, and say, hey, this is something that is benign. This won't grow. This won't go anywhere else. This is not going to threaten survival at all. You'll be fine. And it's those sorts of stories, and there are a lot of those stories where there's kind of a confusion as to what. There's a lot of medical terminology in radiology. There's a lot of specific nomenclature that can be a little challenging sometimes to decipher. So that was one story that we've had recently, but there are a multitude of stories where people come in. What does this mean? Is this terrible? Is this not bad? Am I going to survive? And I love being able to interact with the patients. I had another one that they used a complex term for it's called mild small vessel disease in the brain. So essentially it's just some mild kind of changes of chronic hypertension in the brain, but a different term was utilized in their report. And they thought, is this a brain tumor? Or am I going to survive? So
Oh.
you speak to me, "Oh, absolutely not, absolutely not. It's just kind of make sure you work on getting the hypertension under control. This is something that is completely fine, that you'll be fine with." So there are a lot of stories that we have where there's a little bit of just a little bit of confusion as to what exactly the reports
Hmm.
mean. And we've been working through the years with American College of Radiology and trying to just to distribute not only a medical but also kind of a patient-centered report at the end to make sure that they're aware of what those findings mean. So we're working on generating kind of for lack of a better term, a lexicon, a specific set of terms to help make sure patients understand, kind of what the findings are in
Hmm.
their radiology studies.